reaching the Last Mile Forum is currently underway in Dubai in the UAE, and it's coinciding with Health Day at COP28. Now, the event examines the intersection of climate change and global health and involves global health leaders. But to tell us more about it, we're joined by Thoko Elphick-Pooley, who's Executive Director from Uniting to Combat Neglected Tropical Diseases. Thoko, good morning to you. Thank you so much for joining us. This is a particularly interesting discussion as we see these talks going on in Dubai over COP28, a lot of it really being about negotiations of resources for just energy transitions. But a really big part of the conversation, obviously, that needs attention is the health element of climate change. Do you think that that gets enough attention at forums much like COP28?
Thank you so much for having me. This is absolutely historic in the fact that in the history of COP climate change summits, there has never been a day dedicated to health. And under the leadership of the UAE presidents, we've seen an entire day, December 3rd, yesterday, we celebrated an historic day where health was on the agenda. And this, as you mentioned, was a fantastic opportunity to recommit resources to ending some of the diseases that are really seeing the impacts of climate change. Yeah. So perhaps I can just tell you a little bit more about why we're so excited about this historic moment.
Sure, go ahead.
So yesterday, the Reaching the Last Mile Forum convened leaders from around the world who came together to recommit to ending neglected tropical diseases. Two diseases yesterday, lymphatic filariasis and river blindness, really saw an extraordinary commitment from world leaders. A new fund worth $500 million was launched committing to end these two diseases on the African continent in 39 countries, including Yemen. This is extraordinary to see the world committing to an end of these diseases in our lifetime.
I think it's interesting that we're talking about neglected tropical diseases that, you know, at some point one could argue that come about as a result of climate change. Maybe talk to us about these two diseases, because if they're called neglected, it really does mean a lot of people don't actually know what we're talking about, right?
Yeah, they are neglected. The people that suffer from these diseases are the ones that are neglected. These are people with little access to water and sanitation, people who are really poor and have little access to healthcare. So these are individuals who are seeing the ravages of climate change in their day-to-day lives, affected by flooding, affected by droughts, and then you add on top of that these preventable diseases that they're already struggling from. So you can imagine, if you're already suffering from an infectious disease and a massive disaster lands upon you and you lose your entire livelihood, it's absolutely awful. But I think what we're seeing even more are the vectors that transmit these diseases. We're seeing mosquitoes, we're seeing sandflies in places that have never been seen before. We've all been reading about the new outbreak of dengue and chikungunya in Burkina Faso. Absolutely devastating. And all of this is the result of climate change.
Yeah, I mean, it's almost so scary, actually, when you start talking about the effects of it like that, particularly when you speak of, you know, the movement of even mosquitoes that is obviously impacted by climate change. At COP28, you talk about the financial commitment that's put into, I suppose, to resource the treatment of neglected tropical diseases. But is there much more that is being done on a greater scale, in your view, to really deal with the effects of it, where, you know, we're seeing really a lot of leaders wheeling and dealing around who pays for climate resourcing here on the continent? Is that being treated effectively in your view?
I think that's exactly what makes yesterday special, because what makes these diseases neglected is the fact that not only are the communities neglected, but also there's typically very little financing that goes towards them. They are devastating. They cause utter suffering, stigma to the populations. They affect country economies. And for me, this is, since I've been working in this area, there are so many areas in global health that are completely intractable problems. For neglected tropical diseases, you invest your dollar in NTDs and you win. These are diseases you can eliminate. But what was extraordinary yesterday, which I really want to celebrate, particularly on SABC, is the fact that we saw new players coming in at a COP and committing at the Reaching the Last Mile Forum. $340 million was committed to ending 2 of these diseases on the African continent, river blindness and lymphatic filariasis, including from African philanthropies and African governments. This is utterly unprecedented and is really worthy of celebration.
All right. Well, we do appreciate your time. Thank you so much for bringing us that element of COP28 discussions taking place there in Dubai. That they're speaking to us now is, of course, Thoko Elphick-Pooley, who's Executive Director from Uniting to Combat Neglected Tropical Diseases, in affiliation, of course, with the Melinda and Bill Gates Foundation.